pile or the hemorrhoid as a whole. So basically, anytime when you vein, the venous cushion at your waist swell, you get tendency for get something mass or swelling where they come off from the angle there. And when you come off from the angle, they limit you for pass stool as a whole. Yes.
So before we can look at within some of the things where they cause, and let's look at the different type of pile.
Yeah. So basically, we get both the internal and the external. If we tend for no say you get vascular cushion or you get venous cushion where they control how you pass stool in and out from your waist. The internal can influence with waiting all list of things them way associate with what. If you notice bright blood from your stool, where you get dinate line where they dey from below, that they deal with internal. But always they get mucus, they get mucus appearance. Then the external, they get very painful external hemorrhoid. They get a very painful approach where somebody can get when they wrapped by the skin, because when the person hemorrhoid come out from a anus, you they see a huge swelling externally as a whole. Then always can acute. So you get both internal hemorrhoid, then you also get external hemorrhoid. Now the two type there where somebody can get, the longer the condition worst, then they come up from internal, then you go into external as a whole.
Okay, so let's look at the severity of this sickness we call pile.
Yes, the very first place, it will become very severe where it lead to somebody one and belly begin dry. When you notice in stool dry, it will lead to say constipation, and when the person get constipation, it can create other sickness them, not only because the belly dry, but it also can make other abnormality they occur, where somebody can get prolapse from the anus as a whole, then other complications, say blood, because if you get pile, you not treat them well, you can get problem for your blood level low, anemia, then you can get some strangulation from the same venous cushion. Then equally you can also get infection, though that can real. Then from in severity you can get grade them, like grade 1 where you get bleeding but not enough for them, no prolapse, no day. They get grade 2 where prolapse day but you get reduced, it can reduce spontaneously. Then grade 3 now, it can lead to manual reduction as a whole. Then grade 4 in associate with permanent prolapse where the waste from the venous cushion they flow out as a whole. Yeah.
So this one we talk about the internal type of pile. Now one way say first person way it go na stool like they see blood there. This now other one way plenty people it I say many a times where they see blood now is too, they say this now the sense they don't get.
Exactly. But the essence of pile, you can even get frequent or you get rombele, but waiting so much important get for deal with the anatomical structure of the rectal part of the human being. Like you get canal, the anal canal, where immediately it inflame, na indication for proof say somebody don't get hemorrhoid. But if you get dysentery, and not get for affect one, the canal, the anal canal, and not also get for affect the venous cushion aspect of the anus. But when you get dysentery, obviously it can mix with blood. But the difference has to deal with the anatomical structure. Because if you belly they run, you get dry dysentery, obviously you can get stool. But the essence with this stool of internal pile in a bright red, indifferent. Because when somebody get dysentery, obviously in a frequent stool, but pile not get related to frequent stool. Na hard stool, indifferent from dysentery.
Yeah. Okay, now let's look at waiting as of the thing where they cause this pile.
The very first way you look at, therefore deal with if you happen forget dry stool, like you they drink enough water, forget proper digestion, you can happen forget hemorrhoid. If you they eat balanced meal like fibers, high content of fibers, less fruits throughout the week, you eat fruit, vegetables you eat. Then at the end of the day, they force your digestion for slow, then also you stool for be hard. And when you stool hard, it can also make where you strain for stool, or you stay in a bathroom, you want to use the restroom, you can stay longer, also can lead to that as a whole. So the primary thing for deal with one, your diet, because again for deal with digestion when you pass stool. Then also when so woman day, for example, woman will get belly, pregnancy can lead to that. Aging, where somebody they carry age, can also lead to that. Then,
so they say small pikin they get pile?
Well, small pikin they get pile because as long as the venous cushion gets affected or the vascular cushion, as long as it enlarge, what they lead to when it dilated, obviously they lead to pile, because no matter of the age, but most likely ageable people, then geriatric, when they don't carry age, the food the way they take, the sedum where they sit down one place, the less water where they drink, so on and so forth can lead that as well.
Okay, you talk about diet. Don't look at what's in some of the food there where people for eat for say get this pile sick.
Yes, you get wide range of, first and foremost, fibers that deal with fruits like pawpaw. You expect to eat pawpaw, orange, pear. Now list of food fruits, then that way you always for conversant with, you always for the take, though not to everybody they will afford, but average fruits then they way less economical. Also you tend for think of vegetables. You get concuba, you get lettuce, you get light things them like beans, all this list of things and vegetables then way they able to make you get proper digestion, because now fibers and that way they able help you get breakdown and good digestion where they help you for get normal stool.
So now look at the lifestyle again of any person, like for people where they smoke, they drink, you get any cause where they lead to pile?
Well, if we look at say something where they influence the venous cushion or the vascular cushion of the rectal or the anal canal, then tendency they say alcohol, like lifestyle, medicine, and they where they cause constipation side effect, we also can lead to that.
Okay.
Then people where they can involve in more of social activities like smoking, drinking, then can tend for sit down one place. Like the longer you do one side, there's high tendency the duration at which you sit down, because you need for be mobile and do some exercises as a whole. People where they can influence in that, obviously based on your sedimentary lifestyle, then get high tendency, more especially alcohol, because you can get constipation. And anything where they lead to constipation, it can make you develop pile as a whole.
So what of people where they get people where they get strain, and also the one where they do add training, then self can also make them get that sickly?
Well, the strain get for deal with weight bearer, like contractor, somebody in a messina, for example, somebody they lift, you know. We all body constitute with blood circulation. You need for blood for the flow, and the major parts then where they play for let you control, let you know get pile, get for deal with vessels, like how circulation for take place. So for example, if you happen for the strain or they lift something heavy, obviously in the process where you the ace, you must detend for, like in Creole word you can say pini. Somebody want ace something, say you know, and in the process where you do that, the anatomical structure of your vascular cushion, obviously there is tendency for make you waiting. You make a dilate or you make a enlarge as a whole, and because that they happen, it can lead to, just in the process of time, it can lead to that as a whole.
Okay.
Yeah.
The program now will Bodi Talk, they come to live from the Society for the Democracy 98.1 FM. Remember, say yourself when you listen and watch me live now Facebook, you go get chance for be part of the program by way you go send a comment or text message to the number 077-981-981, or self you go now the Democracy Facebook page. And later on inside the program, with the open phone line, inside people will call the number 077-981-981, 077-981-981, and the number where you go be part of the program. As I still get with me, Dr. Amadou Adosain Joanna, in the Registrar Family Medicine Department at the University of Salon Teaching Hospital Complex. And today inside the program, we talk about understanding piles, causes, early symptoms, safe treatment, and surgery matters. Well, Dr. Joanna, let's look at again. Pile get anything for do with genetics, like if your mama or your papa gets pile, if you born picking, the picking self they get them, or is it a family to get something?
Yeah, well, it can be family history. You get some few angle of that because, for example, if your parents then get body, they yourself happen for put on weight. Obesity can be at risk factor for what you get. Then family history, if also the parents that happen for get background history of such, the tendency for make the pikin themselves inherit that it can be in a closer proximity as a whole.
Okay. So now let's look into the early symptoms them of pile.
Yes, so the signs and symptoms, as I said earlier on, both the internal and external. For internal aspect, person can then begin notice say 1, 2, 3 days and a pass stool. Immediately when you notice saying belly dry, constipation can lead as one, for example. Then equally, when the belly dry, if it force for pass stool, it can get bright red blood. If you get bright red blood now, you stool can be one internal aspect. Say, hey, something they will want develop. Also, when you the pass stool, you can notice the stool. You can notice prolapse, like something one come up from your waist where the hang na do. All this get for associate with internal aspect. Then you notice some amount of discharge, like you get wastage of when you pass stool, little thing they come off from you internally. External symptoms them. Obviously you get painful swelling. Immediately you pass stool, you notice say painful swelling. Then it can also acute. And not only acute, you can notice irritation, like the waist you get disturbance, you want pass stool, you waist warm, or you notice say you the itch, you the scratch from your waist. So that also can also be external aspect. So both the signs and symptoms can be internal, then it can also be external.
So now look at in the area of the prolapse where say like we pass in the toilet, they feel like
something
they come out. So if the person they in the process for toilets, then that's in the common. Now look at the effects where it gets.
Yes, well, the effect can very severe because we get a case of where a young student, one fall in the category we say obese. Okay. Get body, you don't put on weight. Then they prepare for exam. They don't sit down long for study. They already aware and know say they get pile, but in the process where they also control the food the way they eat. In the process where they want stool, as they go for use the restroom, they find out for say a notice swelling where extract or where come off from me in waist, in anal canal. So what happen? In that state where they enable sit down.
Okay.
So he use pack a stool actually, but immediately where stool forcefully physics come out where stool. What he do? A pack, a use pad for pack, then he dress up, then he can at the outpatient. So when he can at the outpatient, the very first thing, the hemorrhoid already don't be external. And if you don't be external, the very first thing you need for do for make provision for waiting for examine. You examine and not go there in that state, you apply lubricant, maybe suppository anosol cream. You apply, you use the glove, then just right round you quietly or simple way you hold the suppository anosol, you rub and right around the wall of the anus, the waist, then you try for put the hemorrhoid back inside. That can be in that form. But there is no way when that happen, many people can afraid. Or get somebody self when I be a foreigner and self experience the same thing. In the process where one stool, because in belly be dry, he encounter the same thing. So such method, you get both the cream, then you get the tablet. But the tablet can melt. You can just put an at the tip of the anus, then you allow and let it slowly go in. I say, oh, but you don't expect for do that you sit down. You obviously get for lay down, maybe sideways, so that you will get good penetration as a whole. We want to check the patient.
So what are some of the risk factors of this spine?
Yes. So as I say earlier on, the risk factor get for deal with one who give example of ageable people can be a risk factor. Who get family history as a whole. Then when somebody gets chronic constipation, some people in days they use the restroom, and the longer that happen, it can be a challenge. Even belly woman as well, where they take medicine we get iron supplement, because the medication we get iron supplement also can lead to constipation. So all these things can also cause the hemorrhoid. So the longer you position yourself, then when you get low amount of low intake of fibers, okay. you know they take fruits, vegetable. You always take food that when a starchy food. At the end of the day, for let them even digest, they take time. Then you not to pass away fruit some. You not to pass away they take vegetable at all. You can be at high risk for get hemorrhoid as a whole.
Okay, so again, now come now to the treatment. Within some of the treatments, them way normally una can get to people away una can don't diagnose get this spine.
Okay, so the very first thing you get for know which category you fall. Okay. Immediately you see which symptoms you get, whether they're internal or external, then which grade they fall, then which complication they present with. So you get one maybe conservatively, just as I give example, such students will be go na the outpatient, it not be need emergency say for do surgery. What it be ever need was now for use conservative application, say you apply one, you get advice dietary. A need for get high content of fibers, way for they take more fruit, vegetable. They watch the kind food the way they take, light meal like bulgur, not too much starchy food. You not go eat cassava, yam, cocoa. Then you assume say, hey, you want to eat the pile. Then they drink enough water, you can get challenged as a whole. Because if you need drink as well, you need a proper digestion. Then in that same conservative aspect, you approach now for use one, if the pile already they out, the person in the hospital, waiting at your expectation. They use suppository where can be cream, can be tablets, but the tablet the income at the same site of the waste you put them. Then the cream you get for gently waiting. Apply the cream with glove. Even though the patients come in, you'd expect for do diagnostics, like for re-examine, do digital rectal examination. When you examine, then you come to a conclusion for apply both the either the cream, the anusol cream we they use gently, but the patient self expect for ledom in sideway position. The ledom with him back, but rather the ledom sideway. Then you use the cream, then you gently apply so that slowly you go able put back the pile inside. That can be in a conservative way. Then you can advise now one based on in diet, the food where they take two, then no go day longer na restroom, because people can get habit for sit down so long na bathroom. And when you sit down so long, the tendency, because one, if you belly dry, you get high tendency for be exposed. So at the end of the day, that can be a conservative approach. The other aspect therefore they'll say, if this person get continuous prolapse, the pile always they come out from the anus, you'd expect say a need for revisit for see the surgeon, where the surgeon go take a decision for reassess, do routine checkup, lab test them, then any further diagnostics required for be done, then they go put now for do hemorrhoidectomy, for choose when for pull the pile.
So they pull them?
Yes, of course. You get surgical approach. You not only get conservative, you get surgical approach. Several times in pull pile.
So how often this pile can come out per person?
Recurrence, not a more again for deal with your diet first. Okay. Because whenever you get pressure now you intra-abdominal muscle, what do you expect? As you get such pressure, it creates problem with you stool, then they influence your digestion as a whole. So if somebody gets an hour small, obviously pull them, and however feel say when it don't come out, it will call back. But the only recommendation, and you always guide maybe dietary, other advices in sedimentary lifestyle for no waiting for take, and imposition of waiting, maybe occupation as well. If they sit down one place too long, because most people can sit down one place for so long, tendency they would then get exposed to that, because the longer you sit down, you hardly use the restroom, digestion, and other things then. Because you also they expect for exercise, you need for be mobile, for move. Because if you need move, proper digestion definitely take place and all that. Yes.
So Dr. Joanna, in a situation now when get the medicine and the way you mention the way how for put her inside back, if in common host then able for go now hospital at that same day. Waiting at some I possibly go then host go able for fix her back quick, or for all I go now hospital?
Yes, so I experienced two cases, as I say, where I manage a young student with a very obese. It happen for come, but if you dey home, the very first thing we required get for deal with how you dey position yourself, because immediately when you get the prolapse, the pile come out, there is no way you dey able first for sit down. It's not possible. Even when you lay down, you no dey able first for lay down, because you dey become so disturbed. So the first thing you expect for do, you need for lay down sideways. When at the very first thing, and you know they do forcefully one with your naked hand. Obviously, stool day, you know they do forcefully with your naked hand. So if you partner day, or your brother, you na man, or your sister, you na woman, your first expectation we required, now the way you position yourself, you get for able lay down sideways. Because if you first say you want lay down with your back, or you lay down with your belly, you expect for lay down sideways, so that waiting. The position of the anal canal and also the vascular cushion can able position well anatomically. Then it easy. The first thing that person they go do if you not get this thing, it need for you something we sterilize, clean thing we sterilize. You either get lukewarm water, you take towel, you slowly or gently. You use your 2 finger, how it come out, you quietly turn for insert them, put them back inside as a whole. But most of the time, people when they're not medically inclined get afraid. Why they get afraid? While will come up married man or married woman, we don't know anything about medical aspect. Immediately that come out, the first thing they do, you know what's in the happen, try for put something under, make we manage go to hospital. But in the process, some pile can come out such way it can come out with so much blood, people can bleed, provided the way how they waste they use the restroom. Because if they bleed excessively, for example, somebody they 4 or 5 days in hospital, then all of a sudden in first stool in physics so hard, then so huge or big, what you don't do? It don't grease the cell wall of your anus. One, fresh blood don't come out. Then it already don't remove the pile out, like it don't extract the vascular cushion. Immediately we pull it out, what's in the happen? It don't suspend out. So if then kind of state the person not medically inclined, obviously na fear the fear first. Say this you know what they do, log hospital. I say well. So in that note, okay, advice one, you can use warm something, like you get towel, you put them towards the waist side, then you wrap them, then the person can dress up aside if you're afraid not for put her inside. Okay. They can do that. Then when they go hospital now, the doctor or the physician where they able apply that method.
Okay. The program now, well, Bodi Talk, they come to live from the Society for the Democracy 98.1 FM. Member say yourself can be part of the program by way of send a comment or text message to the number 077981981, or self you go now the Democracy Facebook page, or self you go call the number 077981981, 077981981, and the number where you go call and ask question about the topic where they do it today in the program. What you want for know about spine, waiting at some of the things where they cause and the symptoms and safe treatment and safe surgery matters. So you go call the number and ask question as we get the experts in the studio with we. When our Dr. Amadou Alusain Joanna and the Registrar Family Medicine Department at the University of Salon Teaching Hospital Complex. As today we talk about understanding 5 causes, early symptoms, safe treatment and surgery. So the number again for call now 077981981, 077981981, and the number for call and ask question. Well, we don't get to first call on the program. Hello, good evening. Name and where you call from?
Good evening.
Please come on your radio and ask a question.
Okay. I didn't look to the top board. We eat heavy food, cassava, yes. I mean, at the same time, we carry for the instant orange, purple, or the yogurt, right?
Okay.
And if you talk about too much sidon, I don't know if that only cause pipe.
Okay, plenty. Thank you for that question. We asked the program as the doctor will able to respond to your question. The program now will Bodi Talk. They come to you live from the Society for Radio Democracy 98.1 FM. The number for call and ask question, but the topic what they do with today, we now understanding pile, which the causal stand, symptoms, safe treatment, and safe surgery matters. The number for call now 077981981, 077981981, and the number for call and ask question. Yes, Dr. Joanna, that will call a day ask say if every food, cassava, rice, and serve too much of sidon the cause pie.
Yeah, thank you so much. I think where you get for deal with diet, where you get low intake of fibers, you know they eat fruit, vegetable, tendency they say you they expose for get pile. The reason why I get for deal with how you they get digestion, you get vascular congestion where inside you belly food for the digest appropriately or when food for digest. So starchy food and we get high content of glucose like cassava we get instance about of tendency they say the process for like cassava or yam or cocoa all the starchy food them can digest without you not take food. Obviously you can expose because no matter of time if you begin take too much of them food and day waiting they happen inside the week sometimes 1 or 2 tell you go the stool then time they each when something I just one tell you the stool. So it also advisable say if even somebody no get nothing na cassava no more he they eat na us or na yam or na cocoa but we still they played. If you want make sure say you not get pile now for make sure say you dey take some fibers them enough fruit vegetable that go able help. But if you be constant person where they take more of cassava yam cocoa then the tendency for let you they get constipation is so slim always. Secondly it made mention about the prolonged sitting.
Yes.
Prolonged sitting or standing also can be risk factor. Why the risk factor now? Whenever you sit down, we earlier on established say you get venous cushion now your waist, you get anal canal, the rectum, all this vascular cushion, this system, anatomical structure of the waist, whenever you know they make the function well. Because for sit down one place obviously, now sit down you sit down by your waist. And the longer you sit down by your waist, you expect for less circulation take place. You don't need for sit down long. You don't eat, you sit down. When you station one side, the tendency for make flow of blood circulation, it is slim or it is less. And when blood circulation less, waiting they happen. Now just matter of time, you obviously go get you go there at risk. You go there at risk. Because not like cause is different from risk factor. Prolonged sitting or standing na a risk factor. Just like when you get somebody way obese, it also be a risk factor. But the direct cause, you not go expect when somebody sit down for long or sit up for long can cause that. But risk factor now na thing we close, thing we get tendency for make you get particular sick as a whole. So prolonged sitting or standing na a risk factor where no matter of time it different from cause. Okay. Because when you get cause now you know go get prolonged sitting it be a cause where you directly give you pile. But whenever you get a prolonged sitting you already there at a risk for get waiting pile as a whole.
The program now will Bodi Talk, they come to you live from the Society for Early Democracy 98.1 FM. Call the number 077981981 and ask the question about the topic we do it today when I pile and we don't get another call now the program. Hello, good evening.
Yeah, good evening, lady. Yeah, thank you very much, and thanks to Doctor. You know, smart call from UK. What I just want to know, just for the doctor knows they don't talk about piles and the area with constipation because other things. Just a few things. I don't know if usually, I remember my own days will be the train. I remember we experience somebody who come to trichuris worm. They call it trichuris, or they get whipworm. So because of the frequent stool and not treated trichuris, it end up of course a prolapse. That's one thing. And then I don't know what advice again he will give towards people that would use paracetamol just for the sake of drinking. But no say it can cause constipation. That's not true. And then I don't know in terms of fiber, because coconut na fiber, raw fish food, we talk of fiber for leg to digest the food inside well. Will get fish too. How much of the fiber? See, because coconut get oil, but I don't know if it's specific for say, well, if you not get this use coconut, so that the food go greater and you belly well. You see, because I don't know, because until at the second, one of the last part of the large intestine, one of the rectum can affect, but the area of the worms and paracetamol and how this will be achieved, then that left lateral position where you see for the door. I don't know how much you go advise, because usually that the way they give enema, like people can get constipation, when they give enema. But again, how people will get constipation for long, then you see them go give free let's say laxative, because all long compile when we talk of the vessels that way they near the rectum. When you give stool immediately, it can cause shock. I don't think it's when they hear a part and cover out blanket. If that was constipation, the pressure would on it and the vessels they would in at the rectum. The moment when you evacuate, even for evacuate, whatever don't constipate, it can cause a body shock. So I don't know how you advise how the treatment and they of those are conventional things. And thank you very much, and we'll always be praising when I always succeed. Thank you very much, Khalifa. Thank you.
Plenty, thank you, Uthman. Well, that's now called from Manchester City. So, Dr. Joanna, the question or concerns the way it is also.
Yeah, thank you so much. Okay, the very first thing, it gives some contribution in terms of the frequent stool. Where obviously, if you they get chronic diarrhea, tendency they say they use the sphincter of your anus, and when you use the sphincter, the longer you use them, you can get prolapse. Well, that's true. Yeah, obviously, people will get chronic diarrhea, tendency they say they get exposed to that. Then, as we say earlier on, some medication get side effects when constipation.
Okay.
And the opioid, like even paracetamol, can be high tendency, because one of the major reasons we use advanced aging as a risk factor, most ageable people they can go na hospital. The very first thing we can find out na the bag way the medications the way they take. And most times paracetamol na way common where all man na the green light. You hear that to paracetamol. Picking body one more paracetamol, but it also gets side effects where can cause constipation, because the more you take plenty, so man they take always not just paracetamol you get. If you not get paracetamol, it will get other analgesic where it always they take for relief pain as a whole, or fever as a whole. So paracetamol also can create constipation, because medication, especially opioid, can lead for make somebody get constipation. Then also it make mention of the fiber, where key instance of coconut in terms of what you able to advise people for take coconut or not for take coconut. Now, when you look to the list of fibers, them high fibers food them way is so much important. The number one food we come requires like pawpaw, orange, banana, apple, pear, you know. Then when you get for deal with coconut, as I likely say, you don't need thing we get high content of fat and lipid, because the more you get high content of fat and lipid, the process at which digestion they take place, it will cause limitation. So we can advise or recommend, just like the jelly water, it's always helpful, but the coconut you don't need for take more of them, but rather less of them. Other list of fruits than they, or other list of vegetables than they required, we can able to take for substantiate, for let you get within high fiber food or content in you as a whole. Then you also made mention of the vessels, like why all within the happen, how person they lay down, whether sideways, you lay down sideways, or when somebody take enema, you go to hospital, then give enema, or then give this lactulose, you know, they always they give something for cause softening, like you get softening stool. At the end of the day, you they get free flow, because when you stool softening, you get tendency for get normal stool as a whole. But in a nutshell, a very important say fibers can number one. If you not get high content of fibers, and at this thing we actually lack. Some homes then they throughout the week nobody no go take any single fruit. So very important as a whole say you always need for get a balanced meal. No matter what, every week let you get some amount of banana, some amount of orange, some amount of pear, pawpaw, provided with you afford. But at all costs let you able get a balanced meal. Yeah.
So doc, the law look at again for pussy we get spile if long and advisable for the pussy for the travel long distance.
Yes, you know we talk about the prolonged sitting and the prolonged standing, and if somebody get pile obviously and prolonged sitting na risk factor, and because na risk factor the tendency for the person and pile disturb am, it they become high, because at the end of the day the longer I sit down the flow circulation as well, because anytime we sit down within the happen all this anatomical structure of you vascular cushion, you venous cushion within the happen, the limitation of way blood for flow and how blood for flow, the tendency for a go accordingly, it become limited. So it's not advisable somebody get pile, it choose for travel long distance, provided if you want to go by flight you can go, probably not that or less, but you not go say you go there, you sit down one place for 6 hours, you sit down one place for 7 hours. The same thing applicable to even standing, because some profession and the way people they exposed to where they tin up for long, like teacher them, policeman them, you know, teacher them, policeman them, people already operate. You know, the longer you do that, the exposure you are at risk as well. You know, so now that's not the thing. So it's not advisable when you get pile, you travel long distance as a whole.
The number for call and be part of the program now 077981981, 077981981, and the number where you go call and ask question about the topic where they do it then at the program when a pile. What you want for no but pile, waiting the cause and waiting at the all the symptoms them except safe treatment and surgery matters, you go call the number 077981981, 077981981, and the number where you go call and be part of the program. So Dr. Joanna, when I don't get in any case like if I don't give the person a treatment, then the pile na thing where they come again back on a thing where they men permanently or you know they men permanently.
Yes, so as we say earlier on, again for deal with based on the approach, the very first you get for think of, you get for consider few things here. The first thing we get for able to think of or consider, again for depend on the severity, how severe it is.
So Dr. John, quick will not take this call. Okay, we don't lose the call. Go ahead.
Again for deal with the severity of the condition, then the grade, which grade it is, then which symptom it present with. For example, let's take a scenario now. You say somebody they happen for get pile, they go to hospital. You get for class first with severity there. Like that students who they talk about.
Yeah.
For example, what thing be happen? It be need for take exam. It be we approach, it take what's required, we use the procedure conservatively, I guess suppository and sol, then what happen? It go back, it adhere to waiting, the advice they will give, it continue with the specific diet we instruct them for follow, then what happen? A continuing exam. So if person there now, it get serious one, let's say the severity so high, then it a very high grade 4. Such individual, the very first thing, it need for be stabilized na hospital. Then when it's stable, the recommendation or advice here for day on the surgeon, we go take a decision for say this situation where you dey, we either need for do surgery so that we able remove the pile totally, or you dey long in a hospital for you dey on conservative treatment. So it can be either way based on the symptoms, the severity, or even the grade as your own.
Okay, with this message from 077981981 they say, Doc, can I please take a sit bath and how often?
Yeah.
Yes.
So sit bath also advantageous in terms, because sit bath not for only for even pile, it also they help for infection.
Okay.
But
okay, so we'll go ahead and take this last lucky caller. Hello, good evening. Name and who the call for? Okay, for the go ahead and ask the question.
Yeah, I get the pellet dry, fast, like each banana, but thinking back to the pellet dry, you know, I get that dry recently. I don't think with me, I can eat banana, the better small, but stay back at the getter, so I don't know.
So for how long you don't say with you?
Well, like I say, now to them 2 years now to 3 years by now anyway.
Okay. Okay, plenty. Thank you for that question. We asked at the program for the. Yes, Dr. John, I can round up on the sit bath and self can answer for the
thank
question.
You so much. So the sit bath, as we say, also a widespread or wide broad format conservative way for treatment, not only for the pile obviously, but you have for use lukewarm. You need to sit bath just ordinarily, but you expect for use lukewarm water. Then either you put the toilet there, then you get for be consistent. Either morning, evening, you get for be consistent with everything. Obviously, sit bath helpful, and sit bath now. Obviously, the whole way they play now for just keep the external aspect. One for keep the prolapse. If somebody get pile now, then when they use sit bath, it able help them as a whole. Equally, the sit bath not only for the pile, but also the personal hygiene, because you'd expect say you need to do sit bath, you just put cold water, but at least lukewarm water. Then you either put the toilet, healthy approach, then the personal hygiene with maybe bath pan, you able to sit on palm. That's very helpful. So sit bath not bad. You can do as your doctor prescribe. If you want to, you do it within a week, 5 days, 7 days, but not to tell you for permanently they do, because he also gets role for play. Remember at the pathway, the anal canal, then also rectum. Then secondly, the person give instance ask question about banana, right?
Same belly guy.
Whether banana they part of the first high fiber food that we expect for take. And obviously not only banana, we can advise say you can also add other things them like pawpaw, orange, pear. It can also take other things for able to help the constipation. But if the constipation too much, then it either need for go hospital so that it will go see doctor. So doctor will give something we go soften in stool. We go able help it get proper digestion, because then they obviously means say they get proper digestion where they consistently they get constipation as a whole.
Okay, so Dr. Joanna, what will be message out there to people for say they able for prevent themselves not forget this pile sick?
Yeah, if we don't know say again for deal with a risk factor for deal with one they do long standing or sitting, you get for reduce that. If you get for deal with medications them where you get side effects, now make where your doctor prescribe, you for be conscious of what you dey take and how long you dey take them. Most people can get problem with that where medicine can done they can still dey go by without them not tell the doctor. Say now this same medicine. So medication we advise say not just to take any kind of medication. Then also your food side. The food side very important. You can afford for it, but make provision every week for make sure say you look for fruit, vegetable where they able help you. Then get the habit for the use the restroom every day. No matter what, you patiently sit down, because the more you keep your stool, most people not can choose for use the restroom in a particular side. Maybe go side and go walk, they're afraid for infection. They choose say me, I only comfortable where gonna me house for use the restroom. But it's very important at any given time, if you need for use the restroom, not joke with that, because the restroom healthy and it will help you. So constipation, for prevent constipation, you for fight very hard for take high fiber food stem, we go able help. Equally, take plenty of fluid, water. Okay, for always drink plenty water. If you drink plenty water, then if you notice anything like that, no go traditionally, assuming say, hey, this thing will happen, now this leaf, now this thing for apply. No, make sure say you go hospital, because remember, you don't know the symptoms, you don't know the grade, then you don't know the severity. Okay. If you don't know the symptoms, grade or severity, how you they treat them, not to so the person way na you work down there for treat. So you advisable for go hospital, either the doctor will treat conservatively or he will treat surgically and so on.
Okay, plenty thank you we joining at the program. In name now Dr. Amadou Alusain Joanna, in the Registrar Family Medicine Department na the University of Salon Teaching Hospital Complex. And today we also for talk about spile, waiting at the causes, all the symptoms, safe treatment and safe surgery matters. Plenty thank you we joining at the program. Well, this edition of the program well, but the talk will left you for today, Thursday, January 15, 2026. Plenty thank you to me producer Musa Kamara, DJ Songa for technical support. Me Kamarabanga will make on watch you live on our Facebook page, and we present this edition of the program well, but the talk. My name is Kaifa to Conte.